slides. You can see my slides, right?
Yes, ma'am.
Okay. As Allie mentioned, I am the program coordinator for Project ECHO, which is housed under the IU School of Medicine. I've been here for just a little over a year now. Basically, I know that at one point you all had a webinar on ECHO, but I just want to give a quick overview for those of you that may have missed it. So ECHO originated in New Mexico through a doctor who was the only physician in the state who was treating for hepatitis C. They realized that there were over 36,000 individuals in New Mexico who were HIV infected, but only 5% were in treatment because they didn't have the ability to get to New Mexico, to get to Albuquerque where he was practicing. So he was thinking, how can I get these patients treated without having to see every single one? So he developed Project ECHO through University of New Mexico. And this is a way to get specialists or to get primary care physicians trained on specialty areas so that these patients can be seen in their own communities without having to travel long distances. It builds community capacity, increases access to care, and overall builds healthier communities. And there are over 250 different complex medical conditions throughout the country being treated or being used as ECHO models. Indiana is just one of the few states that has it, but the world is now using ECHO as a model to train primary care physicians. So more about Project ECHO. It stands for Extension for Community Healthcare Outcomes. So, and its mission is to democratize medical knowledge to get best practice care to underserved people all over the world. So it uses a hub and spoke model, which I'll talk a little bit about that further, but it's a way to increase workforce capacity. We realized that people needed access to specialty care for complex medical conditions. There weren't enough specialists in certain areas, especially rural communities. So figuring out a way to train those physicians remotely and quickly, actually, to get people the help they need so that patients can get the care they need in the right place at the right time that's convenient for them. So as I mentioned, it is a hub and spoke model. It's also an all teach, all learn model. So the hospital in the middle kind of represents the hub, which in this case would be IU School of Medicine. So we have a hub of experts that meet at our school. And then the rest of the community or the providers participate remotely using Zoom, just like you're all doing. So an actual ECHO clinic would be very similar to what we're doing right now. So community providers learn from this panel of experts through IU School of Medicine. And then the community providers can learn from each other. And then a lot of times the specialists learn from the community providers on what's happening, what's really happening out in the state and the resources that are available or inadequate to treat certain conditions. So one thing the ECHO is not is it is not telemedicine. So we get this question a lot. How does this differ from telemedicine? So as I mentioned, it's a hub and spoke model. It's a way for a certain number of experts to train several learners who in fact then can reach out to dozens more patients. So there are no patients involved in our ECHO clinics. It's not traditional medicine where a prescriber would be seeing a patient remotely. So it is different. And then I'll transition a little bit more into the Indiana OUD ECHO program. So this is a partnership led by IU School of Medicine. We are supported by 21st Century Cures money through the Division of Mental Health and Addiction. So it is free for all participants. We were originally awarded the contract in the fall of 2017. It was recently renewed or it's being renewed right now. And then it will be current through September of 2020. So we have funding for quite a few more programs, which I'll tell you a little bit more about. We employ 1.5 full-time coordinators. One's myself, and then another gal, Caitlin Riho, with Indiana Prevention Insights down in Bloomington, which leads me to, this is a cross-campus collaborative team. So it's us, IU School of Medicine, IUPUI Fairbanks School of Public Health, and then Prevention Insights, which is through IU Bloomington. So all of us work together on evaluating the ECHO model and coming up with the clinics. So specific to complex or to treating for opioid use disorder, we felt like this ECHO model would be awesome for this approach because there are so many barriers to treating opioid use disorder. Patients are really reluctant to engage in treatment in their own community, let alone going, to Indianapolis or another more urban area. And there's so much stigma around treating for opioid use disorder, not only within the community, but in sometimes healthcare settings. So, there's a lot of reluctance to using medicated assisted treatment due to the idea that it's trading one drug for another. So we do a lot of stigma reduction or talks about evidence-based models and ways to reduce stigma. Lack of coverage for treatment and supportive services, or just the actual amount of treatment available. Community stigma about opioid use disorder, and no one wants a methadone clinic in their communities, and just reluctance to be treated where other folks who are suffering from opioid use disorder are. So that's another barrier to treating OUD. Lack of transportation. I don't know if there's an ECHO session that comes up that we don't talk about how difficult it is for patients to get, to Indianapolis or a couple hours to the methadone clinic daily. So, reducing that. And that's the one thing about ECHO that's been great is we've been able to identify barriers across the state so that we can, talk about that to legislators or people that are more interested in helping to reduce some of the barriers. Lack of collaboration between providers in the communities, or, sometimes there's just no communication between the providers, or there's only one provider or no providers. So just trying to increase the access to providers, and then inadequate funding for treatment and supportive services. And then, just looking at the opioid crisis in general, on the left is non-fatal emergency room visits due to opioid overdoses. And then on the right is deaths from those drug poisonings. And the darker blue is, the more high-risk areas. But then, so you look at this map and, it's clear there's a problem all over the state. But then you look at the map where it talks about the medically underserved areas and populations, especially on the right with the mental health professional shortage areas, which includes, almost the entire state except for those urban areas like Indianapolis and Chicago area. So, it's clear that we need more providers in the state treating for opioid use disorder. So I'll jump right into what tracks we're currently doing. So we do have an adolescent track that is training folks on substance use disorder. So this isn't focused just on opioids, but all substances, including marijuana, cigarettes, alcohol, vaping is a big thing. So that meets every other Wednesdays from noon to 1:30. We have the prescriber and dispenser track, which is going to start in May. We've done this, we've done 12-week series several times, but our current contract with DMHA is requiring us to do an annual or a year-long track. So every week in the upcoming year from May to May, On Wednesdays, there'll be an opportunity to log in, Zoom in from noon to 1:30 to learn more about treating for opioid use disorder. And I mean, we indicate this is really for prescribers, but I mean, we encourage behavioral health and community health workers, anyone that's interested in being involved on how to be more involved in treating for opioid use disorder. We do have other tracks that will be more specific to behavioral health and community health workers, but we don't want to exclude them from this session either. So we also have an early childhood home visitor track geared to first steps, Head Start, healthy families, nurse-family partnerships. We realize, you know, a lot of them are on the front lines when they're confronting families or dealing with families that have been affected by opioid use disorder. And it's really more of a overview on what opioid use disorder is and trying to reduce some of that stigma and let them know more about Medicaid-assisted treatment. So that meets monthly on Tuesdays. And then we are starting next week a specific track for intervening and assessing and treating for opioid use disorder in the emergency department. So this will include the whole gamut of professions that are involved from start to finish, including, you know, those that are involved in check-in process or prescribers, behavioral health, peer recovery, nursing, social work, anyone. So our expert panel looks a little bit different each track, but for the most part, we try to have someone from each of these categories. So the medical legal partnership has been huge. So having an attorney involved who can talk about some of the legal issues that are involved with someone with opioid use disorder, not only child support issues or criminal issues, but also discrimination in housing or jobs or, you know, how to get transportation. So, you know, sometimes healthcare providers can be the best advocates or sometimes the only advocates for folks who are going through some of these issues. So we thought it was pretty pertinent that they are informed about some of these. And then psychologists or psychiatrists to talk about this psychosocial intervention, such as cognitive behavioral therapy or, you know, just motivational interviewing, how to get people to talk about changing. Peer recovery support, not only to identify why it's important to have peer recovery employers in the facilities, but also just getting that perspective from somebody who's in recovery and just some of the mindset, going through of those that are, in the currently using medications and why they may not get into treatment or what is holding them back. So psychiatry, both for adolescents and adults. Also pregnancy is important too. Outpatient pharmacy, we have a pharmacist who is very helpful when it comes to a lot of the medications, some of the medications that are being abused, drug interactions, talking more about Medicaid-assisted treatment. Someone who prescribes MAT in a primary care setting is really important. And then also social work and case management and just talking about some of the social needs of the individual. This is just a picture of one of our ECHO sessions. And then our learning objectives are a little bit different for each track, but this is generally the prescriber track, just learning the neurobiology of the brain of opioid use disorder, how it affects the brain and changes the makeup, assessing and diagnosing OUD, evaluating risk and protective factors, using best clinical guidelines, best practices, and managing in emergency room settings and community clinics. Monitoring OUD for adherence and tolerance and effectiveness, evaluating whether it's being, if what they're doing is really being effective. So these objectives look a little bit different for each track, but this is just kind of a general idea, gives you a general idea. And then this was the curriculum for the 12-week session that we had for prescribers. I do want to mention again that it's free continuing education. We do adapt some of the curriculum materials from the ECHO Institute, but a lot of it is specific to Indiana rules and guidelines. And then at the end of each session, we we ask for an evaluation so we can measure the effectiveness of the program that particular day. So as you can see, we talk about, assessing and treating co-occurring mental health conditions along with the opioid use disorder, managing OUD in the office. So as you can see, we only have one session that focuses on office management of OUD, which is kind of why we're breaking this out into a year-long series, just so that we can get more detailed into some of that. We may have just one whole session on drug screening, or one whole session on how to talk to your patient about opioid use disorder or intervention or screening. So we hope to get more into the weeds of a lot of these topics. So this is just the sample curriculum for the prescriber track. And then this is the curriculum that's coming up for the emergency department series. So the thing I like about this is that, we're going to talk about some specific programs that are being used throughout the state, and there aren't very many, but there are a couple pilots out there. So Clark County, who's using a bridge program on collaborating with community partners, is going to give a talk on their program. Talk again about stigma. We can't talk about it enough. Montgomery County is doing a Suboxone program out of their fire department and emergency medical services. So just talking about that, some of the barriers they're facing, how to get folks treat, a dose of Suboxone once they're in the emergency room, but then also connecting them to treatment once they, the next steps after they leave. So this is what that series looks like. It starts April 25th, and it will be every Thursday from noon to 1:30. As I mentioned, continuing education is free for all of these professions. Each session is 1.5 hours. So we do give the CE per session, not per overall series. So if you, for the year-long track, if you could only attend once a month, so that would be 1.5 hours a month. Or if you, twice a month, 3 hours. I'm sure you can do the math, but just to, to point out that you don't have to attend every session. We realize that's not really realistic. So we just want people to be, able to use this resource when they have time to do it. And then just kind of an anatomy of the echo clinic. So one way that this is a little bit different than an echo is that we do introductions. So we try to create a collaborative feel, more of a classroom style feel. We want people to realize that they're all in this together and they're kind of working on the same, cause, and they're able to connect outside of clinics. We've found that, they've been great resources to each other, being able to help each other. So that's why we spend time on introductions. We do then a 20-minute didactic with question and answers. And then the thing that's very unique about ECHO, and part of the main component of it, if you will, is the de-identified patient cases. So we try to do 1 to 2 per week. One of the providers out in the community will present a complex case, and we'll just kind of walk through best resources and best practices. So I'll talk a little bit more about that in a second. But this is, during the didactic, we would share the screen just like I'm doing now. It's just a sample. And then to go into a little more detail about the case presentation, they are de-identified, so no patient health information. Once the case is presented, then the spokes, the other providers in the community, will have an opportunity to ask questions, and then the experts ask questions. And then both parties have, the opportunity to make recommendations and share their knowledge and resources. And then written recommendations are submitted to the participant only. And we do like to do a follow-up at some point, have the presenter present later in another ECHO series on how that patient's doing, how we can learn from, some of the challenges that they've faced, or if there's anything that should be changed. This is a sample case presentation form that we would display during an echo session. So as you can see, we talk a lot about the opioid use history, but also some of the social factors such as employment and risk and protective factors. So this is a little more basic than some of our cases. You know, as you can imagine, a lot of them are very complex. And then this is just another shot of one of our sessions. We really do like for people to turn on their camera. I think it creates more of a collaborative feel, but I mean, we understand it's over lunch hour. Some people may be eating or walking down the hall or just on their phone and not able to see the PowerPoint, but you know, it's adaptable, but it does, I think, create a more collaborative feel when everyone turns on their camera, and it leads to more participation, I think. Just regarding the evaluation piece of it, this is just a screenshot of we've been tracking echo minutes, so how many minutes somebody in a particular community has been participating in echo sessions. So, you know, the larger dots in the middle of Indianapolis, there have been more than 1,000 minutes spent on an echo session. So just kind of our way to evaluate effectiveness or whether people are actually participating. This just is kind of a breakdown of some of our tracks. This is a little bit outdated, but just by maybe a month. But this is just like the number of overall participants. I mean, some of those participants participate in multiple sessions, but just kind of a breakdown of how many we've had per session. The early home visitor one is really popular. We average about 60 people per session, so which is a little bit challenging during introductions, but some of them have participated in like a hub model, like all of them at once at a particular location. So, which can be done in a clinic if the whole practice wants to participate together. That's, you know, that's very doable. And then coming soon, as I mentioned, the emergency department. In the fall, we're hoping to start a medical complications session, like medical complications related to opioid use disorder. So it would be endocarditis and some behavioral health implications. And then a gel-based MAT program, probably the first of next year. Again, the benefits to participants, no cost CME or CEUs, that professional interaction with colleagues that are kind of, you know, experiencing the same thing, treating for the same complex condition, dealing with the same challenging, difficult patients. We've found that it kind of creates less isolation, you know, and improved recruitment for knowing that, you know, there are other people out there that you can confide in and get help from. Resource sharing, just not only among participation, but also there are materials that will be available to those that participate, our PowerPoints and other resources that we share. Access to consultation with specialists. So as I'm sure many of you know, there are very, very few addiction psychiatrists in the state, and almost all of them participate on our ECHO program. So just being able to get guidance from one of the very few addiction psychiatrists in the state, I think is invaluable. And then for those of you that might be interested in going through the loan repayment program through Department of Health, this does meet one of the qualifications to get reimbursed for those loans. It also meets the requirement of the controlled substance registration renewal that I think it's 2 hours regarding opioid use disorder or pain management. So this does meet that criteria for renewal. And then just some of the preliminary outcomes that we've been able to evaluate is, you know, greater confidence in being able to manage patients with opioid use disorder. Helpful aspects are developing, you know, that network of providers, getting a panel to weigh in on those difficult cases, finding out more about patient support groups around the state that you may have not known about before. And then these are just some quotes that we've taken out of some of our evaluations. So, you know, just again, feeling more comfortable listening to patients without pressuring them to change. We talk a lot about change talk and behavioral changes, why someone may not be quick to change. So I think that's been very, very helpful. And then just a few more testimonials. I think, you know, I talked a lot about creating this collaboration and resource sharing. And I think the first quote is pretty telling and kind of highlights that. In the case I presented, it connected us from people from We Care as well as Regan Street, so they were able to create this resource that now they're working on helping this lady together. And then I do want to highlight that Fairbanks School of Public Health, who I mentioned that we collaborated with before, does have some other ECHO projects, and I believe someone will be talking more specifically about those at another Lunch and Learn, but just to kind of highlight, we handle all the opioid use disorder tracks. They do have a hepatitis C. They have an LGBTQ care, HIV. They are starting a peer education and community corrections setting, which is really interesting. I think Andrea Janota is scheduled to talk about that at a later date. Medical complications and opioid use disorder, and then, as I mentioned, jail-based MAT program in 2020. And so if you're interested in enrolling, this is our website, oudecho.iu.edu. Tracks is probably the quickest way to figure out which series you might want to participate in. We do a pre-session evaluation and a post-session evaluation. So just kind of ask preliminary questions such as, what is your confidence level in identifying someone with substance use disorder? Those kind of questions. So we like to track before and after just to determine effectiveness. So just a heads up, that's a part of the registration process. And then, as I mentioned, we have resources available. So there's a resource page that has our PowerPoints and whatnot if you ever want to, you know, check those out. We also do record the sessions. So if you aren't able to make a particular session, I would be glad to share that. And then this is the general page that we share with Fairbanks School of Public Health that has the other sessions, information about the other sessions. So that's echo.iu.edu, and that would lead you to the opioid use disorder series. And that's all I have. I guess I kind of sped through that. I'm sorry.
Well, now I was on mute and started talking. Thank you, Kristen, very much for that presentation. A lot of really good information in there. We'll go ahead and wait for just a second. We'll open it up for anybody that has questions about the ECHO. And I didn't actually see any come in on the chat function, but if you want to use the chat function, do that as well. Okay, well, I'm not hearing any questions come in right away. I will say if everybody could use the chat function to just let me know what facility you're attending from, we do appreciate that very much. It helps us be able to have these programs for free. We collect this kind of data. I will also provide a survey link. It's a very, very brief survey. Probably will take you 2 minutes or less to complete. I'll share that in the function now. If anybody would like to take just a moment to fill that out, we greatly appreciate that for our data collection as well. Finally, we have recorded today's presentation and we'll be posting to our YouTube channel. It's very easy to find by searching for Indiana Rural Health. We have a channel on YouTube and have quite a few of our presentations on there. You can share or watch again or post our links anywhere you would like. We like to have as much reach as possible. So I'm going to go ahead and share the link to the survey and the chat function now. If anybody has any more questions, please let us know. And I think with that, we'll probably go ahead and wrap it up for the day. Kristen, thank you.
No problem. Thank you for having me.